Hi everyone, hope you're doing well. Happy Friday to you. Hope you've had a really beautiful week. The weather's so gorgeous outside. So sitting and coming live to you from the porch. Today we're going to be talking about upcoming lives and important awareness dates, kind of like, different awareness months that are going to be coming up in the next 2 months, things that we might talk about on the space, just to give you a heads up of what's to come. But we'll wait for Whitman-Walker to get in the room and then we'll get started. In the interim, I'll introduce myself. My name is Jewel and I use she, hers pronouns, and I work to bring educational Instagram lives to this space with Whitman-Walker's community health team. Again, today we're going to discuss just important upcoming health and awareness dates and just give you a peek into our upcoming Instagram live schedule. During the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to include social media platform. So we cover various topics about HIV and STIs, sexual health practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. Also, take a peek at the pinned comment below. If you are interested in getting an HIV or STI test, you can always do so by making an appointment with Whitman-Walker Health. You just need to call 202-797-4439 to schedule your testing appointment, and you can get your test either near Logan Circle or in Anacostia. We've got Whitman-Walker in the room. Welcome, Whitman-Walker. So yesterday kicked off the final quarter of 2022. I can't believe, and can you believe, how fast the year has flown by. As the year begins to come to a close, we wanted to give some time to highlight some upcoming meaningful dates. So first off, we've got September is PCOS Awareness Month. PCOS stands for Polycystic Ovary Syndrome, and this is a hormonal disorder common among women of reproductive age, or people with reproductive organs who are of reproductive age. Women and people with PCOS may have infrequent or prolonged menstrual periods or excess male hormone androgen levels. September is also Sickle Cell Awareness Month, and so sickle cell disease is an inherited blood disorder that affects red blood cells, and people with sickle cell disease have red blood cells that contain mostly hemoglobin S, which is an abnormal type of hemoglobin. Sometimes these red blood cells become sickle cell shaped or crescent shaped and have difficulty passing through small blood vessels. When sickle cell shaped cells block small blood vessels, less blood can reach that part of the body, and tissue that does not receive a normal blood flow eventually becomes damaged. This is what causes the complications of sickle cell disease, and there's currently no universal cure for sickle cell disease. It's also a pretty painful disease. If someone who's experiencing it, you might know that they are on medication to help relieve them of the pain, or just have a hard time standing up for long periods of time. So just be aware of that, and be kind to your friends, be accommodating to your friends in that way if they are battling sickle cell disease. September is also Suicide Prevention Month, and it's a time to raise awareness around the stigmatized and often taboo topic of suicide. If you or someone that you know is struggling or in crisis, help is available. You can call or text 988 or chat 988lifeline.org to reach the 988 Suicide or Crisis Prevention Lifeline. September 18th is National HIV/AIDS Awareness, or Aging and Awareness Day, recognizing the community of people who not only survived the early days of the HIV and AIDS epidemic of the 80s and 90s, but the ones that are also living and aging with HIV today. Given that an HIV diagnosis was a death sentence back in the 80s and 90s, it's really incredible that we have people who are aging with HIV today. September 23rd is Bisexuality Day, and it's a day to uplift and raise awareness about bisexual individuals, history, and community. September 27th is National Gay Men's HIV, AIDS, and Awareness Day, and this is a day to recognize gay, bisexual, and MSM communities who have been impacted by HIV. The 27th is all about testing, conversation, accessing treatment, and knowing your status. September 28th is National Women's Health and Fitness Day. So this day is celebrated every year on the last Wednesday of September, and it falls on September 28th this year. It's a special day to promote the importance of health awareness and fitness for all women. Next up, we're getting into the October dates. October is Breast Cancer Awareness Month, and that's a time to raise awareness about breast cancer diagnosis, treatment, and practices to catch it early, as one of the best ways to fight breast cancer is to catch it as early as possible and begin treatment as early as possible. October is also LGBTQ History Month, and it's a time for uplifting the achievement and historical milestones of LGBTQ trailblazers and community members. October 11th is National Coming Out Day, and it's an annual LGBTQ Awareness Day observed on the 11th that supports lesbian, gay, bisexual, transgender, and queer individuals and people who are coming out of the closet. And just is a day to remember your coming out story if you've already come out, or maybe to encourage you to come out if you haven't yet. But also for the folks who are unable to come out, this is a day for folks who are able to be out and visible to raise visibility around coming out of the closet. October 15th is National Latino HIV/AIDS Awareness Day, and it's a day for raising awareness around HIV and how it impacts Latino communities and the ways we can practice HIV prevention, treatment, and regular testing. October 19th marks LGBTQ Plus Center Awareness Day, so it highlights the instrumental work of LGBTQ community centers. Also a great day for giving. If you want to support an organization like Whitman-Walker Health, we are still a nonprofit, so definitely appreciate the support that folks showed to us via donations. October 20th is Spirit Day, and this aims to create awareness for bullying and harassment that LGBTQ communities face, with an emphasis on LGBTQ youth. October 26th is National Transgender Children Day, and is a day to honor and acknowledge all transgender children who have long been hiding in the closet and cannot wait for whatever reason to come out. To come out. It is a day to open your arms and welcome these children and let them feel included in the family and community. October 26th is also Intersex Awareness Day, and it's a day for raising awareness around intersex individuals, their health needs, and the importance of maintaining paths for individuals to identify as intersex before assigning them male or female identities. Those are just a handful of dates that are coming up in terms of health and prevention and awareness to keep on your radar. These are dates and topics that we'll be covering in this space moving forward as we go into our fall months. We mentioned sickle cell awareness, we mentioned breast cancer, we mentioned HIV a handful of times. The fall is also a really popular time for walks and 5Ks. So if you have people in your community or your family or your close friend circle who are impacted by breast cancer, by sickle cell, or by HIV, you can sign up for the upcoming walks. I don't have the exact dates handy right now, but the sickle cell walk's coming up in September. October has a breast cancer awareness walk and 5K, and then Whitman-Walker has its 36th annual walk and 5K to end HIV coming up on October 22nd. So if you want to support any of the efforts in combating these diseases, these are awesome ways to get involved. Before we go, I just wanted to share a few reminders about HIV and STI prevention and testing services available through Whitman-Walker. So you can learn about Whitman-Walker Health's testing hours and locations at whitman-walker.org/testing. HIV and STI testing are available by appointment at Whitman-Walker's locations, and you can call 202-797-4439 to schedule a testing appointment. Again, that's 202-797-4439 to schedule a testing appointment. Whitman-Walker's health centers are located at the Max Robinson Center at 2301 Martin Luther King Jr. Avenue Southeast in Anacostia. And Whitman-Walker Health's 14th Street Center is located at 1525 14th Street Northwest near Logan Circle. If your community or organization is interested in the Whitman-Walker team providing mobile health services in your neighborhood, you can contact mobile health at whitman-walker.org. You can also access PrEP, PEP, or start HIV treatment with Whitman-Walker Health at Max Robinson Center or at Whitman-Walker at 1525. Thank you all for taking time to learn a little bit more about important upcoming health and awareness dates. And of course, before we go, we want to give you a few reminders about the COVID-19 vaccine. If you've already gotten vaccinated, congratulations. You've taken a really important step towards helping prevent your loved ones and yourself and your community from getting sick. Multiple variants have soared across the world, and it's totally understandable why you might want to keep wearing your mask, as the vaccine isn't 100% effective at preventing new cases of COVID. But it's very effective at preventing people from getting really sick with COVID, from preventing people from ending up in the hospital with COVID, and from preventing people from dying from COVID. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has COVID-19 vaccine available. Please call us at 202-207-2480 to make an appointment. And if you're having trouble making an appointment with us, or we're just out of the way for you and you're a DC resident, you can find more information about COVID-19 vaccines at vaccinate.dc.gov or by calling 1-855-363-0333. If you're a Maryland resident, you can visit covidlink.maryland.gov or call 1-855-634-6829. And if you're a Virginia resident, you can visit vaccinate.virginia.gov or call 1-877-829-4682. If you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine, discuss COVID precautionary measures with those around you, and be mindful of masks and keep your distance. But especially when you do not know whether a person has been vaccinated or not who's around you. And because we're battling more than one public health crisis and pandemic at once, we want to slow on to share some information about monkeypox. There are tens of thousands of cases of monkeypox documented in the U.S. Currently, and in D.C. you can pre-register for a monkeypox vaccine appointment if you visit the D.C. Health website. Virginia is currently working with local care providers to contact, trace, and identify those most in need of the monkeypox vaccine. And varying counties in Maryland are allowing residents to pre-register for a monkeypox vaccination. Please visit your state's local health department for more information on how to register and get vaccinated against monkeypox. In D.C., as of Friday, August 5th, walk-up vaccine locations are available from noon to 8 p.m. on Fridays, or while supplies last. D.C. Health monkeypox vaccination clinics include one at 3640 Martin Luther King Jr. Avenue Southeast in Ward 8, one at 7530 Georgia Avenue Northwest in Ward 4, and one at 1900 I Street Northwest in Ward 2. Walk-up vaccination locations will be provided on a first-come, first-served basis to eligible residents who have not already received a first dose of the monkeypox vaccine. You are currently eligible to be vaccinated in D.C. if you are a District of Columbia resident, 18 years of age or older, and this includes all people of any sexual orientation or gender who have had multiple sexual partners in the past 2 weeks, including those currently considered highest risk, which includes gay, bisexual, and other men who have sex with men, transgender men and transgender women, or sex workers of any sexual orientation or gender, or staff of any sexual orientation or gender at establishments where sexual activity occurs, aka bathhouses, saunas, and sex clubs. Proof of residency is required prior to vaccination, and that includes, or acceptable forms of residency include identification cards with a DC address, a utility bill or other piece of mail with your name and a DC address, or a current DC lease or mortgage with your name on it. Thank you so much for tuning in today. Please consider getting vaccinated for monkeypox and or for COVID-19. And please continue to follow our Whitman-Walker family at Whitman-Walker on Facebook, Instagram, and Twitter. And you can also follow along with our Whitman-Walker family at RealTalkDC_ and at NoFilterDC on Instagram. And you can visit whitman-walker.org to keep up with the latest information on our services. Thanks so much, and wishing you an amazing rest of your weekend. Bye.